I just want to reinforce, the point that Ken Chang just made with regarding to collaborative working relationship between our gastroenterologist and GI surgeon. So here at UCI, we have 4 GI surgeons, and we work very closely with our GI colleague on a variety of management of the foregut issue, and reflux is just an example of one of them. The way the patient gets to our center is, through our gastroenterology colleague. I mean, because the first thing is first, you have to have the diagnostic evaluation. You have to get the appropriate test before you provide any surgical option. So a lot of our patient sees Ken Chang and his colleague, for evaluation prior to even coming, for a surgical consultation. And a lot of these patients these days have do a lot of research into their condition, particularly hiatal hernia and reflux issue. They're very savvy with regarding to treatment option that's available. And one thing I've heard, and Ken, you can correct me if I'm wrong here, is a lot of these patients do worry about gas bloat symptom, the issue of a Nissen fundoplication. So TIF provides a good option for these patients. However, in certain scenario, these patients do have a hiatal hernia. That can be an issue for the TIF procedure because the hiatal hernia needs to be fixed. So as a surgeon, what I think we should do is to work collaboratively with our GI colleague, because the hiatal hernia repair can be done relatively expeditiously. We can do that procedure quite quickly. And I think, having a concomitant TIF procedure with a hiatal hernia repair just makes sense. It can be done at the same setting, and the patient can leave within 24 hours. So I think it's definitely a good option to consider for a patient, with reflux and hiatal hernia repair. I think it's important to mention that, anti-reflux procedure in this state is a multidisciplinary approach. It's not just a surgical approach, it's not an endoscopy approach. These day and age, I think we have to look at it at the multidisciplinary. So it's very critically important for a surgeon to work with our GI counterpart to offer the best treatment option for the patient. And this is just a single example of what we do here at UCI. We're planning to approach this, concomitantly, whereby we perform the laparoscopic procedure, reduce the hiatal hernia, and perform the anti-reflux procedure transorally, all in the same setting. So certainly that will provide the best patient care, in a single hospitalization for the patient.
I think the TIF procedure also underscores how important it is to have this multi-specialty, multidisciplinary approach to foregut diseases, to esophageal diseases, to heartburn, in that it's a spectrum, whether it's heartburn or Barrett's or early esophageal cancer. As gastroenterologists, we need to realize what things we can do, what things the surgeons can do. They need to know what we can do. And case by case, it can vary. I can take it to a certain point, and then takes over, or he can do certain things, and then I'm back on, or we're working together. So there's this ebb and flow between specialists that is seamless, and I think that's really the modern way to take care of these patients.